but more on that in a moment. Before we will jump into the content, I would like to take a note for some technical moments. So first, I would love to ask all of you, please, to mute yourself if you are not going to be speaking and you're not supposed to be speaking at this moment. This might be disturbing for the participants that are taking their time to pitch, or other participants speaking at this moment. Second of all, we are having here a main screen, which is pre-acceleration program. So, and this is information needed for those who are right now in the Zoom. So we have this pre-acceleration program coordinator participant. If you'd like to see the speaker together with the presentation on your full screen, you can pin that participant, and this is what you'll see on your screen, and it will be a great view for yourself. For the pitching part, we will inform you on how to best set up your screen as well. So in case you also have any technical issues, something is blurred or something, please write in our chat, and we will be happy to help you with those moments. And now, after taking some time for technical things, I am going to jump straight into what we are going to talk today about, and what is awaiting us for this evening. So the Health Tech pre-acceleration program is organized by Civita and Radartech with the support of VHR Ukraine. This is our first pre-acceleration program, so we are really, really thrilled to showcase you some outcomes and results today. Before we will move on, I would like to say a couple of words about the organizers of this program. The first organizer is Civita. Civita is an international consulting company with more than 10,000 projects behind our back. We are present in more than 20 countries. And we are challenging the traditional norms of consulting as international collaboratory, providing different kinds of services for also different kinds of stakeholders from private and public sector in different parts of Europe, also in Nordics and Central Asia. Our team represents Innovation Stream, and we work with different kinds of projects in different segments. We do work on innovation funding attraction. We do have projects in startup ecosystem development. We support small and medium enterprises. We do corporate or innovation, and we also develop innovation studies. We work with a lot of different kind of clients, and among our clients are Unit City, Ministry of Digital Transformation of Ukraine, European Bank, GIZ, Nova Poshta, Fozi Group, Roche, and others. Another organizer of the program is Radartech. Radartech is an innovative company that leverages open innovation and drives companies' growth and transformation. We promotes the growth of startup and has a very big impact on the development of innovation ecosystem in Ukraine. Radartech was established 8 years ago and is present on the market for 8 years. And since then, Radartech was doing a lot of projects that included scouting solutions for specific business tasks, conducting programs in various formats, acceleration programs, hackathons, ideathons, educational programs for entrepreneurship development, and others. Among clients of Radartech are very big Ukrainian international companies, such as Kyivstar, Ukrbank, DTEC, MHP, Silpo, Pump, EIT Foods, and others. And moving on from the organizers of this program, I would like to introduce briefly what we are going to have today. And our demo day agenda is the following. So first of all, for the first 15 minutes, we are going to have an introduction. After that, we are going to have a really nice discussion with healthcare representatives from different sectors during our panel discussion. Then we are going to move to the most awaited part of this evening, pitching and Q&A by our 9 startups. And after that, we will have a short announcement of some prizes for our participants, as well as a gratitude and wrap up of the day. So moving on with that, I am really, really happy to welcome to the world, to this virtual stage, Dr. Jarno Habicht. Dr. Jarno is WHO representative and head of WHO country office in Ukraine, and he'll say a couple of words on behalf of WHO Ukraine. Dr. Jarno, please welcome here to the stage.
Thank you, and thank you for having me, and wonderful to have so many colleagues, friends, and everybody around this call. First of all, I wish that we have both the energy and electricity for the coming hours to discuss, because that's something very important as we live through what we live through now in Ukraine. From the World Health Organization side, it's a great pleasure that we can support all the health and technology crossroad, if I may say so, because while the ideas from our side were there for some time ago, then we started to implement that even more at the time of war, since Russian Federation invasion on the 24th of February 2022. And we launched the first hackathon in 2022, early autumn. And we felt that it's very, very important that we get the technology colleagues together, health colleagues together, and find some new ways how we can contribute, also ensuring better access to care, but then also bringing us all together towards the success. And then in April, just 3 months ago, we met again with many of you around this call to look what we can do further. And now, as we know, we are having number of teams today together to share their experience and to think what can be done further. And some of you are also eligible for the awards. I'd like to thank Post-Civita and Radartech, because without you, these events would not happen. We as the World Health Organization can help. We can bring some of the expertise. We bring our own resilience to what we do in Ukraine while we are doing response, recovery, and the reform support at the same time, while delivering some of the support in the front line, at the same time being very inspired as Ukraine has taken forward its path towards the European Union. And without you and your energy, and those of you who are brave enough to turn on your cameras, I think we cannot change and we cannot make the country better. We do all of this also as we always rely on the partners and donors. I like to thank also Canada, who has been a partner, who is helping WHO to invest more to the primary care, what we do with chronic diseases, as well to ensure that we are moving on the path of universal health coverage. So those colleagues who know me, I can talk a lot, but I think the wonderful part would be to listen to you, to share, and to really see how the health tech community could come together. We had those dreams. I remember when I arrived to Ukraine in 2018, we talked about hackathons. We saw many of those supported by the countries, including Estonia, happening in different places of Ukraine. I think our task now is to do those more, find out solutions, engage through the different sectors, and ensure that we contribute to the resilience and the strength of Ukraine. So thank you, everybody who is contributing, everybody who is putting their energy into this. And I wish all of you safe journey now during this meeting, but then also onwards as well, because your safety is extremely important to make Ukraine a better place. Thank you. Over to you.
Thank you so much. I am going to share back my screen, which I assume you'll see in a moment. Thank you, Dr. Jarno. And then we are continuing We want to give a bit of background for you, what has been going on over the past couple of months, and where do these amazing 19s that you will hear about today come from. So in April, Civita, Radartech, and YEP organized already the second health hackathon in Ukraine, which was supported by WHO, the Canadian government, Ukrainian Startup Fund, and the Ministry of Health of Ukraine. This event was a part of the global initiative Building High-Value Health Systems, Harnessing Digital Health and Artificial Intelligence, in collaboration with Harvard Health Systems Innovation Lab. Ukrainian teams worked alongside with the teams from different countries, Boston, London, Peru, and others simultaneously, and we had a couple of hackathons happening simultaneously in different parts of the world. What was happening during the hackathon? We had 27 teams with around 120 participants who worked together over the time frame of 48 hours, and they were coming up with solutions in 3 different challenges, which are cancer, mental health, cardiovascular disease, and diabetes. And all of the teams were divided in these challenges and subgroups, and one winner in the subgroup or challenge got a monetary prize afterwards that they could use in order to develop their solution further. After that, we selected 10 best teams to participate in our pre-acceleration program, and 9 teams made it till the end, and today we'll be sharing their solutions and pitching and answering the Q&A from the expert panel. Over the 2 months of the program, these 9 teams received 6 workshops on different topics, such as gaining customer insights, segmentation strategies, how to perfect pitch, how to develop outreach strategies, how to develop business models, and others. They also all had lead mentors that spent with them a lot of hours in order to help them develop their solutions and be ready to present what they are going to present today. And as a highlight or summarization of the pre-acceleration program, we are going to have a pitching session today where all these 9 startups will be having 3-minute pitch and also 3-minute Q&A in order to answer any questions and also be able to present their solutions to the wider audience, which is you all who are joining us today and also watching us on YouTube and Facebook. In order to continue with our program, I am happy to continue with the panel discussion, and for that I would like to invite here the 5 participants of our panel discussion, which will be about health tech sector development in Ukraine and how different stakeholders can take part in it and stimulate that development in Ukraine. I am pleased to introduce here the moderator and the speakers of the panel discussion. And our moderator is Yuri Volodymyr Blavt, partner of Civita Ukraine and also co-founder at Challenger Accelerator. You will see Yuri just in a minute. Our panelists are 4 amazing speakers. Some of them you will see a couple of times during tonight. Firstly, I want to welcome here Dean Cairns. Dean is Health Programs and Service Delivery Lead at WHO Ukraine. Dean was also present at our health hackathon, helping out teams during the event. Welcome here, Dean, and you'll see Dean as well just in a second. Our second speaker of the panel is Aaron K. Aregai, an Information Management and Risk Assessment Officer at WHO Ukraine. Aaron will tell us a bit more on how WHO supports digitalization in the healthcare industry. Welcome here, Aaron. I am now also welcoming our third speaker of the panel discussion, Kyrylo Honcharuk, a CEO and co-founder at Chekai. Chekai is the startup, one of our alumni of Challenger Accelerator program. Also, Kyrylo is a board member at Ukrainian Diabetes Federation. And overall, Kyrylo is very engaged in the development of healthcare industry in Ukraine, and he'll share a bit more his thoughts on that. Welcome, Kyrylo. And our last but not least welcoming speaker at this panel is Volodymyr Nerubenko, co-founder at TerraLab, Lab24, and Nasnaga, and also board member at Ukrainian Health Tech Cluster. And Volodymyr also will be sharing some insights as a health tech entrepreneur in Ukraine for this panel. Welcome, Volodymyr. And I am welcoming here to our screen all of the 5 speakers in order to start the panel.
Hello, my name is Yuri Volodymyr, and I have an honor to be a moderator today. In 2020, the whole world was hit by coronavirus pandemic, and this fostered the adoption of innovative and digital technologies all around the world across health systems. In 2022, the Russian aggression against Ukraine started, the full-scale invasion to Ukraine began, and it even further contributed to new challenges that Ukrainian people and our society, as well as a health care system are facing now. So in the meantime, we are seeing the rapid adoption of enabling technologies such as artificial intelligence, quantum computing, and others. We are also seeing a large number of Ukrainian entrepreneurs trying to develop and developing interesting health tech digital solutions. So we are living in interesting times, and I would like to start with my first question to Dean Cairns. We know that digitalization is one of the WHO strategy pillars. What are the guiding principles for developing and adopting digital health tech solutions?
Thanks very much, and definitely excited to be back with you all. And as a follow-up from the last hackathon that we did in person, it was a fantastic and fantastic event, and really happy to be back with you as well, to be part of this really great initiative. It's a good question, because there's obviously a lot of momentum these days around key technologies such as AI and, like you're saying, machine learning and deep learning and all these things, and a lot of big catchphrases, and many different areas that these are impacting us on a daily basis. And the momentum, if this is increasingly, something we have to be conscious of, that how quickly this technology is progressing and impacting our work life and health. And it's easy to get carried away. And I think, a lot of the principles in terms of, the guidance that's coming out from WHO, especially about the use of digital technologies in health is not losing sight that we need to use this technology in terms of keeping people at the center and having this aspect at all times in terms of development of new technologies and how we're engaging in that conversation, that it's there to serve our needs and to improve our livelihoods and health quality and all these sort of aspects too. And that's something I think we need to have in, when we're coming up with different, assessing new technologies in terms of their fit and if we should be investing in them, about what they bring to our quality of life, and not forgetting that the human being is at the center, and that we can all get, very, very much wrapped up in numbers and computer screens and all these things. But we need to make sure that these technologies are there to improve our lives, and not forgetting that, this is an aspect that it needs to be at the core of all our work. There's obviously other areas in terms of data privacy, and ensuring that people are kept safe when everyone's, working with numbers and on their computers and everything like that. It can be something that we could forget that we're dealing with the lives of people, and that potentially if we're working with data that might be something that they might not be working with. And so when we're working with new technologies and coming up with solutions, this is something in terms of some key aspects as well. And then I think it's also important, and a key pillar for WHO is the accessibility aspect. This is something we need to look when we're talking about, new technologies to improve health outcomes, and we're designing solutions that, these solutions need to still be accessible for all. And there's a lot of people out there with, limited access to mobiles and internet access and fast internet access. And so when we're coming up with new technologies, it needs to be equitable as well. That if we're putting these in terms of and linking these to core health services, that we need to make sure that all society has still equal access through these mechanisms, and it's not just favouring a portion of society as well. I'll let my other colleagues speak to other points. I don't want to take up too much time, but definitely issues around ethical and legal issues that we want to keep at the center, but also make sure that a lot of these solutions, when we're talking about health, they're scalable. There's something that can, they can be sustainable as well. And so we've tried to put these principles down in some of our key guidance documents that we've been sending out from WHO in recent months. But thanks very much.
Thank you, Dean. Thank you, Dean. Actually, as my colleague Olena mentioned earlier, for the hackathon where you were judging the teams earlier this spring, we had 3 challenge areas: cardiovascular diseases and diabetes, mental health, and cancer. Those were like 3 topics where participants were developing their solutions to solve problems in that areas. 2 years ago, when actually Aaron was participating in our first hackathon, we had a bit different challenges back in 2022. So I want to ask the next question: what are the most pressing healthcare challenges that innovative digital solutions can address now? And putting us in the context of a healthcare industry in Ukraine. Aaron.
Thank you, Yuri, and colleagues. I hope you can hear me well. I would say yes. It's purely privilege as well from my side to be here, and I was gutted to have missed the in-person hackathon that you guys have run in April. It was a big success. So maybe before responding to your question, I think Dean has covered your first question, which is quite important, and as WHO as well, we have outlined the guiding principles in the action plan for the regional for the European Regional Office in Copenhagen. And one of the things that highlights there, which Dean has covered, is on the patient-centered digital solutions. But on top of that, I think some of our solutions need to also be geared towards the need of the citizens, plus the healthcare workers should be also included in the conversation. So like, what are their needs when it comes to service provision? And the other thing which is emerging now is, and then this is based on the assessment that was done recently for all countries, including Ukraine, is that there is a lack of evidence when we bring new technology or digital solutions towards healthcare services, meaning that there are a number of innovations out there, but there is lack or limited evidence to support that these solutions will make impactful change in the outcome of the health of the population. Saying that, I will go to your question, trying to answer what are the pressing healthcare needs that digital health can support. I think the bigger picture that I think before going into the specifics of the health needs, we, as not only Ukraine, but I think globally and regionally in Europe, I think the health workforce, a trained health workforce, is becoming a real challenge to provide adequate services. And digital health could be a real game changer when it comes to kind of efficiently using then the healthcare workforce, which is available in our hand, without extending the needs of having like 10 medical doctors. Instead, you can provide a service within like 2 or 3 trained medical doctors when you have a good healthcare solutions that are supported by digital health. Saying that, I think in Ukraine, in today's Ukraine, after the full-scale invasion, it's becoming evident that the mental health challenge in Ukraine is becoming extremely critical, that we need to invest in our digital health solutions if we want to reach. Dean was mentioning about accessibility of these digital solutions, and one of the challenges with mental health services is making those services accessible to people who need them the most, including elderly, people who are living in isolated villages. And I think digital health could play a big role. So this is one of the challenges specifically peculiar to Ukraine. I think NCDs, we know, is one of the main burden of disease, and also contributing more than 70-80% of both mortality and morbidity in the regional perspective in Europe, and that's not different as well in Ukraine. So I think we believe that bringing some digital solutions to address NCD, and as we know, the non-communicable disease is very broad term. There are a number of cases there when it comes to cardiovascular diseases, when it comes to cancer, as we know it's always on the rise. So including all these situations that we see from NCD could be also one of the, I think maybe a couple of more outside the box could be also early detection of communicable diseases is becoming also a real game changer. We can't say we succeeded during COVID, but I think there's a lot of room for digital health to help countries, including Ukraine, to detect communicable disease or infectious disease that are cross-border or localized in nature, to detect them as early as possible, so that it gives us a room to respond them in a very timely fashion. And I think AMR is becoming also one of the key challenges when it comes to, I know I'm using a lot of abbreviations. Overall, I think the microbial resistance is becoming also an issue for Ukraine and beyond. So I would say, in a nutshell, these are the main priorities as WHO and member states as well in Ukraine, that we see that digital health could really be impactful. Thank you.
Thank you, Aaron. I think your answer to my question provides many insights for maybe our audience, where there are actual need that we will be looking to see patient-centered solutions that offer accessibility to different people in our society. Also, I really liked your idea of the room for developing new technologies, digital technologies that improve efficiency and tackle the problem of a lack of scarcity of healthcare workers. And traditionally, we have a negative statistics regarding NCDs, so that's also like a huge area for an opportunity for inspiring entrepreneurs to build new and novel digital solutions to tackle some of those problems. Now, I have been seeing many health tech solutions actually like in Ukraine for the recent years. They are there are new entrepreneurs entering this field. But now I want to ask my question to the tech entrepreneurs here, Volodymyr and Kyrylo. What are the main challenges you face as a health tech entrepreneur when developing solution in health tech in Ukraine?
I will start first. Yeah. First of all, I would like to thank you for Civita and Radartech and say you made a great job with the acceleration program as well as with hackathon and such kind of projects. They really develop and really help to help step young entrepreneurs to grow, to make first steps. So it's a really big deal and great project. And about your question, yeah, it's health tech industry. It's a very interesting and specific industry because health tech has a deep social impact. It's between business and social impact, let's say. And for my experience, the biggest challenge for me, and I see it's in other different businesses as projects, it's a go-to-market process. Because from one side, you have a great technology, you could have a great idea, you could have a great team, but it's more difficult to move it to the market, to launch it in the market, than, for example, in other industries. So for us, health tech entrepreneurs, it's a most biggest challenge to launch your idea, to launch your project in a market. And it's the first and second problem. It's most the same. Yeah, it's differences in the markets in the different countries. So that's a big challenge when you launch your solution in Ukrainian market. It's a big challenge to launch this kind of solution on, for example, EU market or American market or other markets. Yeah, it's about differences and different rules and also different regulation in different countries. So from my perspective, it's the most biggest challenge for all health tech entrepreneurs.
Thank you, Volodymyr. Kyrylo, what do you think?
I will jump here, if you don't mind. So, yeah, I totally agree with Volodymyr. That's the biggest challenge, and one of the biggest challenges is the go-to-market. And just to add to what he said, that's when I speak with young entrepreneurs in health tech, I usually recommended them, if it's possible, to test technology outside the health tech industry. So if you can test it on fitness, sport, other industry, it will give you a good and huge advantage on the competitors on the time to market. So you can test it easily, quickly, because health tech as the industry From one side, it's really tough regulated and a lot of barriers with the regulators, with uncertainty how to adopt new technology in the day-to-day process. And from this other side, it's a lot of bias about new technology. So as I can compare from my background in digital transformation, it's like 20 years ago in IT, when we go to the cloud, everybody was afraid about cloud and no one wanted to adopt it. And now it's more or less the same with emergency technology in health industry, because people are a little bit afraid. And what Volodymyr said, that it's had a huge social impact on the life and well-being. So bias are multiplied by this impact, and afraid of people how to this impact will affect on their lives.
Indeed, the strict regulations, standards, and complexity of healthcare systems, and all those differences, like different setups in different countries, make it quite difficult for startups to enter and the markets. And this go-to-market is probably the most challenging for many of them. My provocative question to Dean Cairns here would be, like, how VHO, what VHO can offer, what programs, what specific initiatives can you offer for the health tech teams to support them in developing their solutions and kind of commercializing them across the borders?
No, thanks very much. It's something, we've actually just had a meeting today with the Ministry of Health and the Minister of Health, and it's also our role in WHO in connecting up initiatives like this with the broader problems that are facing the country. I think that's a key piece in our convening role in WHO and working in Ukraine, in terms of how we can bring partners together to foster solutions for rather complicated problems as well, involving many, many actors. So I think in terms of how we can support the innovation community, especially in the health space, is how we can actually clearly define some of these problems that allows accessibility for teams and for organizations to work on these problems. So that's one of the key areas specifically for us in Ukraine. But then also there's a lot of works in terms of the toolkits and that we can provide, and some considering these sort of ethical issues around working with digital solutions in the health space. And as Aaron mentioned previously, there's a number of guidelines and toolkits that are out there to kind of support individuals who are working in the space and who might not be necessarily coming from a health background, but have a passion to kind of and see a solution for or applicability of this technology for in the health space as well. So I think there's a lot of sort of aspects in terms of the guidance material that we can provide with WHO, but then also how we can also link up with other actors in this space. The other thing that we've been working on as well is how do we connect with other countries in this area? There are a lot of technologies being produced in the region. How do we sort of ensure that those who are working on similar sort of problems here in Ukraine can connect up with the expertise in the region as well? And that's something that we're working with our public health team and Aaron's team to ensure that there's greater sort of coordination and resources available to have that free flowing of knowledge. But also there's a lot of things that have been developed and progressed here in Ukraine. There's a great opportunity for those in the region as well to actually learn from the Ukrainian experience, given the innovative and unique challenges that this country is facing. It also provides a really good environment to push and challenge innovative individuals and teams. So I think in that sense, it's our role in WHO to kind of support that coordinated effort in the region and to make sure that people have the opportunities to access these different forums, and something we can be definitely looking towards to do in the coming year as well in that space.
Indeed, WHO has very broad expertise and international expertise that I encourage everyone to tap into, like via guidelines or via like mentoring opportunities. And there is a saying that if you want to go fast, go alone, and if you want to go far, go with a team. So you know, those challenges are quite substantial that we face now. And if you want to solve something, I encourage everyone to kind of consider like leveraging the VHO soft power and the network among different stakeholders. That helps. That could help a lot. Okay. Thank you. Thank you, Dean. Volodymyr, you as a serial health tech entrepreneur, I know you recently was appointed as a board member of Ukraine Health Tech Cluster. What role do you envision for Ukrainian Health Tech Cluster in accelerating health tech initiatives in Ukraine?
Yes, thank you, Yuri, for this question. Our main goal and our main activities, it's to build bridges between Ukrainian health tech entrepreneurs and the world. I mean, to build bridges between health tech entrepreneurs and communities in the different markets, with the different organization, with the first partners, with the first hospitals, with the first users. Yeah, and it's our mission. It's now a goal to make matchmaking, to help build a strong network for health tech companies from Ukraine with different organizations and companies worldwide. So I think it's very important because, as we discussed it before, it's a big challenge to try your solution, to validate your idea in a different markets. So right now we try to find some best combination of relation with different organizations in different countries, with association, with hospitals. Yeah, it's right now it's our main point. And also we build bridges between companies and government, with talk about regulation and etc. So altogether we more powerful to communicate, to create this connection and make this bridge. Yeah.
What new trends and opportunities do you see within the health tech sector in Ukraine for those who want to build their like new startups?
From my point of view,
yes.
Yeah. If we talk about trends in Ukraine, right now it's we see two big powerful trends. It's first of all rehabilitation area, because we have a lot of cases in this. So it's first of all physical rehabilitation, and as well as mental health and mental rehabilitation. So yeah, it's sad, but it's two big trends right now. But as you said, from another point of view, it's a good opportunities for young entrepreneurs and health tech companies to solve this biggest problem we have in this field.
Kyrylo, do you want to add that?
Yeah,
Anything on this?
I will be happy to add a few words, and to totally agree with Volodymyr about these two big trends, especially about the post-traumatic syndrome, which is a huge problem now. But I want to come back to the point which we started at the very beginning of our discussion, that chronic disease in Ukraine, it was or non-communicable disease. There was a huge problem before war, and now due to the war, situation goes worse and worse. For example, with diabetes, our Ministry of Health prognose predict that in after the war we will have more than 3 million people with diabetes, which is huge numbers, and at the same time with the cardiovascular disease and others. So due to the lack of medical staff, due to a lot of infrastructure which is destroyed, one of the biggest trend is to address this lack of resources, which we are need to compensate with the emerging technology. And what I see from my experience in Europe and around the world, that the same problem is relevant for the rural area in Europe, for the emergency country around the world. So the problem is there, and now one of the trends is to address it.
Dean, Aaron, maybe question to you, like also like building on top of this trend topic, what are those international trends that we should kind of keep in mind or kind of follow here in Ukraine as well? What are those like hot or maybe hot topics that in healthcare that is both like beneficial towards Ukrainian health sector development, and also, you know, where we can see next unicorns in healthcare?
Maybe I will give it a try and Dean will complement. And it's not an easy question because as I was trying to highlight earlier, I think any digital solution has to be kind of more organic and homegrown, because the fact that we design a digital solution has to start from the needs, the health needs of the local population, rather than importing from whatever works in, let's say, in Denmark or in Germany or something like that, because there are some peculiarities, right? When it comes to health service provision in Ukraine, the first thing should be like landscape analysis of what are the needs in Ukraine. Then that will give you a strong basis to then innovate. So this is, I think, the bigger picture, that we need to be very careful not to kind of import whatever solution to working somewhere. However, as you rightly mentioned, there are some interesting trends that the tech startups could learn from. And these are, I think, more user-friendly technologies that could be used, because from the health needs, we are increasingly seeing that a lot of elderlies with NCDs living in remote villages are the one who are really struggling to access services across the board, I think. And when you bring some innovative solutions, I think we have to keep this in mind, that very sophisticated applications might not help this group of population. So what we are increasingly seeing is like more very simple, user-friendly solutions that can be also easily integrated into the kind of broader health service delivery kind of system and information system that the countries are building. And the other maybe added value also we see is like using existing infrastructure and existing platforms when you design a technology or a solution should be, I think you have to leverage on what is existing in the current existing health service infrastructure, rather than, because governments are hesitant to invest in any infrastructure when you bring a good solution. It could be a good kind of innovative solution, but if it requires heavy investment, then there will be a lot of policy decision that couldn't be not in favor of the developers. So for us to capitalize, I think we have to consider existing infrastructure, then the policymakers could find it easy to give us a go on those. So I think those are kind of more, I'm sure they might not give you the answer maybe you are expecting, but the broader picture, I think for me, the bigger message will be homegrown, organic, and I think we have to be very careful not to import solutions that are working somewhere else. Thank you.
Simple copy-paste might not work, that's for sure.
Maybe just to quickly compliment Aaron from my side, and I think for those who were at the hackathon a few months ago, I remember that presentation I did in terms of where I've seen the best solutions on using digital solutions in health and AI and all the big fuss around these areas, is that where people have brought their own personal stories through these technologies. And I mentioned that, you know, the app that my friends had created for based on like mimicking my sheep and these sort of things. And I think a few of you came up to talk to me about it afterwards. But it's when you can bring your own personal kind of unique context to these technologies. And Ukraine has a very unique context and dealing with a lot of very unique challenges. And I think that's in terms of where I think the world will be looking to Ukraine for some of these sort of key areas. And like, you know, there's aspects in terms of access to services, which there's some very challenging aspects of that in Ukraine, which I think other parts of the world are looking to now in terms of how Ukraine's dealing with this. Also looking to, like Aaron's already mentioned, and some of the other panelists, in terms of telemedicine and what's going to be developing in this space and the different localized solutions around these parts. But then also importantly on mental health, you know, the mental health burden in this country is extreme and complicated. What are those sort of unique technologies that are going to support those sort of a Ukrainian, a Kiev approach, your local community approach to dealing with the burdens that are happening within your own community? And I think that's the part which we need to look to. Everyone wants to the challenging aspect of these technologies and something that the saleable product that can be big and broad and go to a lot of clients, but it's also how do we actually make something that's relevant and applicable to your neighborhood and something that can be rolled out in terms of the challenges that the people around you are facing as well. So just to keep that in mind at all times, the organic approach, I think that Aaron talked about, is really important in terms of it coming from the problems that you know of, the problems you really understand, and how you can bring your own unique solution to those as well. So yeah, thank you.
Thank you for this recommendation, Aaron. Dean, sorry. The last question from my side, where I would ask for a very quick answer. What is like the single most important advice you would give for startup founders early in their journey?
I will answer, yeah. If we talk about one advice, it's you should be most closely to your customers, as close as possible. So you should be on the hospital side, on the doctor side, on the patient side. So it's for young entrepreneurs, it's for all entrepreneurs actually. Yeah, you should be most closely to your users, to your customers. And one more quick advice, it's think globally. Even you're on early stage, even you just start to work with your idea, you should think globally and think how to reach globally your potential users and your potential customers. It's most important. It's not depends on the stage. So even your early stage, you should do this.
Thank you, Valdemar.
Yeah,
Maybe.
if I can
Okay.
add. Yeah, okay. Let's go.
Aaron?
Okay, sorry, Kirill. Yeah, I think it's not very different from what Volodymyr has outlined, but I think engaging users, whether it's from the service providers as well as citizens or patients, we have to make sure that they are fully engaged from the planning phase all the way up to design and implementation. I think that would be the main advice we would give from, and that gives you a base to get a trust as well from the users at the end of the day. So that relationship Volodymyr has mentioned has to start all the way from the design and planning phase. Engaging with them and addressing their needs will give us a good foundation to be trusted. And once we have the trust, I think we have all the success ahead of us. Thank you.
Get out of the building, talk to your customers, get their feedback. Yes, Kyrylo, closing
Yeah.
remark from you.
Yeah, I'm totally agree with Aaron Volodymyr about customers. It's really key. So because a lot of startups focusing on the technology, not on the use cases or who are using their solution. So customer is key. Technology is a secondary because you can bring technology when you understand what is the really problem. But behind this, to understand, I think the team is one of the key focus. So you need to have right team to understand challenges and to understand how to address them. And for sure, test, fail, test, and do it again.
Great, thank you. Thank you a lot. I have plenty of insights written down here. So thank you a lot for this discussion. I hope our audience also enjoyed it. Thanks a lot for joining us today. Thank you, Dean and Aaron from the VHO side for supporting this initiative, the pre-acceleration program and the hackathon. Thank you, Volodymyr and Kyrylo, for being with us today and also for being with the teams and helping with the teams as lead mentors during the pre-acceleration program and during the hackathon. Now I give back floor to Olena.
Thank you very much, dear panelists. I am going to move back to my presentation. 1 second. Thank you very much for such an insightful panel discussion. It was really interesting to hear perspectives of different stakeholders in the ecosystem and see how many different ideas and insights are there. And right now I'm happy to move to actually the probably most awaited part of our event, and it's pitching and Q&A by our teams. So our 9 teams worked for more than 6 weeks tirelessly on their solutions in order to, first of all, bring great solutions to the Ukrainian and then global market, hopefully, but also to present them today for you. They will be now pitching those solutions to you and to our expert panel. For those unfamiliar, pitching involves delivering a concise business presentation to attract clients, investors, or partners. On the screen, you can see the pitching order for these solutions. However, if we just received the information from one of our teams, Doc Assistant, that is actually consisting mainly from surgeons, and they have a surgery to do right now in just a couple of minutes. So we will let Doc Assistant to pitch first. But otherwise, this is the pitching order that we will keep and adhere to. And I will be trying to say the name of who is going to pitching right now and also the next up to pitch so you can get ready. Before we start pitching, I would love to introduce you our expert panel. Very experienced people who are going to be listening carefully to the pitches and also then asking questions from the teams in order to help them improve their solutions. I would like to welcome right now our expert panel. First of all, we are going to have Dean and Aaron in our expert panel again. They are representatives from WHO Ukraine, and you just listened to some of their insights. Now you will also listen to some of their questions to our startups. Besides Dean and Aaron, we are going to have two more experts. First one, Natalia Hryn. Natalia is surgeon at Medical Network Dobrobut. She's also application analyst at Startup Wise Guys. So she has seen a lot of different health stack solutions and startups, and definitely is set to ask really curious and interesting questions. As I know, Natalia is without electricity right now, so she might be having some technical problems, but we, of course, all understand and will bear with that. And our last but not the least expert in the panel is Erkki Mulder. Erkki is a managing partner at Verge Health Tech Fund and a seasoned health tech investor and entrepreneur. Erkki also co-founded Health Founders, a platform that supports ambitious health tech founders through coaching, mentorship, and connections. So also welcome to our expert panel. Welcome Dean, Aaron, Natalia, and Erkki. And right before we are going to pitch and listen to pitches, I will remind some rules. So first of all, pitching is going to happen over the maximum 4 minutes. We are having 3 minutes for a team to pitch and 1 minute to present demo. Some teams will have demo inside their pitches, some after that. But I will just remind that it shouldn't be more than 4 minutes in total. I will be stopping if it's stopping the team and the pitcher if it's more than that. So please try to fit into that time frame. And after that, we are going to have 3 minutes of Q&A with our distinguished expert panel. For the listeners to our pitching, in case you wouldn't like to see the picture as you have now pinned, you can unpin the Pre-Accelerator Program Coordinator, and then you will be able to see a shared screen with the presentations from our teams. And without further ado, I would like to start with our first team who is going to pitch. And I would like to welcome here the team Doc Assistant and Mikita presenting. Doc Assistant has discovered the future of oncology with its automated clinical route platform, which is designed to streamline patient care and improve outcomes. Please welcome them already set with their presentation. And I also already have my timer ready to put on start. So Mikita, please let me know that you are ready.
Yeah, I'm ready.
Awesome. And you can start your 3 minutes.
Is my presentation on display?
Yes.
Thank you very much. Hello, everybody. My name is Mikita, and I'm a surgical oncologist from National Cancer Institute. And the same doctors as me are forced to spend up to 2 hours a day processing completely unimportant and cliched requests formed by our patients. What to do, where to go, when do we start, and so on. So a huge part of my day is being completely wasted for processing their questions and being their assistant. So we came up with an easy-to-use automated AI solution that improves the communication between the doctor and the patient, reducing doctor's workload and increasing efficiency while releasing anxious of the patient during his road to the treatment. Our team includes highly qualified specialists in healthcare management, entrepreneurship, and so on. And the main thing about us is that we have a huge network of oncologists from around the world. So we have an ability for a quick test with our colleagues and patients. First of all, we focus on the US market because it has the highest salaries among the oncologists in the world. And believe me, there are a lot of them working over there. So we calculated the market size by estimating the amount of saved hours per each doctor using our AI assistant, Doc Assistant. We are going to offer this solution to oncological hospitals without the concierge service as a SaaS subscription model with a 1-month trial and the annual price of $1,200 per doctor. After small research, none of our competitors offer same simple automated solutions and algorithms. So Doc Assistant stands out due to its benefits for both parties. We are going. Our first initial strategic focus includes presentations during the for the decision makers in hospitals, during the congresses and conferences, in personal networking, and during the specialized exhibitions. During the last 2 months, we did significant MVP achievements, such as collaborating with 4 physicians and 24 patients, conducting 11 customer interviews, and obtaining 1 letter of intent. While working with our several strategic partners that are interested in supporting our mission. So here is the demo.
We create an MVP as the chatbot that has a patient and a doctor's interface, and the functionality for each of these categories of users has its own unique features. Patient as users activate the chatbot, choose their doctor, and can contact the AI assistant at any time, who will answer their questions and forward the request to the doctor when it is crucial. Doctor as users activate the chatbot for the first time and register with the platform, and can then manage the chat with the patient at their convenience. Moreover, we are working on enabling the chatbot to analyze patient data, providing insights to doctors for more informed decision-making and improved patient outcomes.
Thank you very much for your attention.
We create an MVP as the chatbot that has a patient and a...
Thank you very much for your attention. We are looking forward for collaboration, and stay in touch with us. You can contact us via provided information.
Thank you very much, Mikita. Great timing. And we are ready to start with our Q&A. And I think you can stop sharing your screen just so everyone else is ready to ask their questions. And I see that Natalia already has a question. Natalia, please.
Hello, thank you, Mikita, for your time. Thank you for your presentation. I would like to ask 2 questions. First of all, how you will protect your personal sensitive data about patient, and is your solution some kind could be implemented or via API for medical informational system? Is it flexible?
Thank you very much for the questions. First of all, the first question, the answer for the first question is that we are going to research on this side of the question, because this information is very sensitive, but the answer for this question hides in the answer for the second question, because yes, it's going to be a part of such a system that is going to be used in Ukrainian hospitals, like systems for working with health and so on, with e-health system. as well as this is actually part of one of the grant programs we are taking a part in EU Beating Cancer program in Europe. So I think we could be provided by them with so high level and qualified information protection systems.
Okay, your ideal customer is Ukrainian customer, or you will also try to find customers abroad, for example, in Europe? My main concern is legal due diligence in European Union is totally different from Ukrainian. So that's the reason of previous questions.
Yes, sure. Thank you for this comment. Actually, the ideal customer is a doctor. First of all, we are targeting the US market, like a doctor from oncologist from the United States. But in the future, it should be implemented in Ukraine, because we are doing, first of all, this application for me, for my colleagues from my department, from my hospital, because nobody knows better than you what you need.
Okay, thank you. Thank you for your time. Thank you for your presentation. Thank you for your answers.
Thank you very much.
Thank you. Any other questions? Dean, Aaron, Erki?
If I can jump in. Hi, Mikita. Thank you for the presentation. Kate from Deepa Ventures here. I understand that you're building for Ukraine. However, are you aware of any competitors / companies that are already doing something similar that could provide you with some support with navigation, both in terms of compliance, but also in terms of faster development and deployment at the customer side?
Excuse me, I think I didn't understand completely well the question. Is it about researching for the competitors?
Let's say,
There are a lot. There are actually several of them. I know pretty clear that Helsi is doing some kind of same application or add-on. But the main feature of exactly our application is going to be these algorithms, because oncological patient always has an algorithm that should be used for personally one individual. So yes, this is the main feature, and I think that we are going to win by implementing exactly this part of the question.
Oh, thank you very much. We are out of time. I just want to remind for everyone, specifically for also expert panel and our pitchers, that there is only 3 minutes that you have. So please be mindful of the length of your questions and answers. And thank you very much, Mikita. We are letting you go for the surgery.
Thanks.
Good luck with that.
Have a good time.
And have a good day, you too. And I am moving on to our next team to pitch. It's going to be Extravision, and the team to get ready is going to be SaySoft. So Extravision and Vladislav. Extravision revolutionizes surgery with its augmented reality tool, which transforms MRI CT data into immersive 3D holographic models for enhanced surgical precision. Vladislav, we already see your screen and your presentation, and I am setting up the timer, and it's set, and you can start right now.
Thank you. Hello, my name is Vlad, and I'm a neurosurgeon, and I'm here to present Extravision, true innovation for surgery practice. When we drive a car, we use navigators like Waze or Google Maps. But when we need to build a route to patient's brain or spine as a surgeon, we don't have proper tools except our memory. Even the simplest surgery can have complications. We always want to see more and be more confident in our actions. AR navigator in front of your eyes can decrease surgery time, help avoid complication, or even save someone's life. With our solution, we already help our customers see inside patient's body before making an incision. How do we make it real? We transform any MRI or CT image based on machine learning algorithm into full-scale, high-resolution 3D hologram straight to AR glasses, so physicians see hidden anatomy projected directly on his patient. During the last 6 months, more than 100 real cases were completed with our prototype in 4 clinics in Ukraine. Additionally, 3 clinics and 1 medical school are ready to use it. We observed that time for pre-op planning is decreased, and now we plan to scale and investigate how it's achieved decreased complication and help students and young professionals to acquire skill more efficiently and quickly. All of this is possible thanks to a team of like-minded individuals. Our team consists of several professionals with different specialization: surgeon, developers, engineer, and lawyer. Expertise of our team helps to develop technology and test it in real surgical environment immediately. Our go-to-market strategy is to spread information on congresses, private meetings with doctors, and professional communities. We also see a big demand in medical educational sector. Understanding the main strengths of our competitors, the main focus we stay on intuitive user experience, AI assistant for surgeon, and educational tools for students and young doctors. We suggest using our application on case-by-case basis or with monthly subscription. We are only getting started and have a long way ahead, but already have valuable achievements. We have working prototypes in neurosurgical departments in Ukraine. We received developmental grant from Ukrainian Startup Fund, and we have adopted our application to all available augmented reality headsets. We're constantly developing and looking for network, smart investments, and great specialists to expand the team. All of this is necessary for us to improve application, conduct clinical trials, and advertising to enter bigger markets. Now let's see how it's actually works. When you put on AR glasses and open ExtraVision application, you see a lot of tools in front of your eyes. You have a library with models of all patients, DICOM viewer with CT and MRI scan. Now you can deal with model, hide skin, bone, vessels to see relevant structures and pathology for planning the best operating approach. And the best part is matching 3D model with real patient, and it's having like X-ray vision for surgeon in operation room before incision. Thank you for your attention, and please contact us.
Thank you very much, Vladislav, again on great timing. We are moving to the session of Q&A. Before we will get there, I just want to mention that we have the priority to ask questions from our expert panel. If you are in the audience and you have questions to our teams, please mention them in the chat, and I'm sure our startups and our teams will be happy to answer to your questions and get in contact with you. Okay, moving on to our Q&A session. Dear experts, who is having the first question? Okay, I think Erkki
Can you hear me well, Olena?
Yes, I can hear you.
This is Aaron. I'm having a connection problem, so that's why I couldn't on my video. I will quickly ask the presenter if there's any plan to do a proper evaluation of what has impacted or the impact of the technology in improved outcome of the surgery.
Yeah, thank you for your question. First of all, our technology helps to decrease time of preoperative planning and surgery. It's a first impact. Also, it can decrease cost for surgery with time of anesthesia and possible complication. And also, we see big impact in helping surgeon to be more confident and have less stress during operation with having direct approach to the patient and to pathology.
Thank you. I think Erkki was the next one.
Yeah, sorry. Thank you very much for this. You said that you're going to expand to Europe at one point of time. Have you already analyzed the competitive situation in Europe or not?
Yes, surely. We have two different groups of competitors. It's first of all, it's neuro navigational station, but it's huge huge stuff, and it costs more than $0.5 million for neural navigation station, and also have a lot of problems with using it. Also, there are some augmented reality companies who look at this problem from our point of view, but we have AI assistants in our application, and also we have a lot of educational tools that our competitors haven't, for example, yet. Maybe they will have.
Thank you. And one question from Natalia.
Sorry, I have two questions. I try to be very quickly. My first question is, how many patients were operated using your tool for the current time? And the second one, do you plan make some updates for another, not only for neurosurgeons, but for example, for head and neck surgeon or someone else? Do you plan this? That's all.
Thank you for your question. For now, it's more than 100 cases were done with our application. It's in Kharkiv and Kyiv in Ramadan Institute of Neurosurgery. And now we want to perform next 20 operation to go to strong MVP stage. And yes, we plan to expand to another specialties. It's orthopedic surgery, maxillofacial surgery, and it's hepatobiliary surgery also. So yeah, we want to expand and go not only to neurosurgery.
Thank you.
Thank you very much, Vladislav, and thank you our experts for this Q&A. And we are moving on to our next team to pitch, which is SaySoft and Remind to get ready. And SaySoft is represented by Victoria Anna. So SaySoft is here to present its app, which uses speech-to-text technology to record, highlight, and summarize counseling sessions in real time. Victoria Anna, I am ready to start the timer. Let me know that you are ready to start pitching.
I'm all ready.
Great. So please start.
Okay. Psychologists are legally and ethically obligated to take notes. Studies show that over 90% of them routinely take notes during or after sessions. Yet, mental health recording is mostly manual. On average, a psychologist spends over 15 minutes writing and reading notes for each client. If there are 4 such clients per day, then it's hours of additional work weekly. This leads to burnout and reduce the quality of care. Our app uses speech-to-text technology to record and summarize counseling session on fly. It provides therapists with instant-ready summary, saving time and preparation for next sessions and supervision, client history formulation, and progress tracking. Why now? Because after pandemic, we see the increasing number of people seeking mental health support, and the acceptance of digital text technologies is also growing. Additionally, the demand for mental health documentation is on rise, driven by insurance companies and third-party payers who require documented proof of effectiveness of counseling session. So now the integration of AI into mental health documentation stands out as a game changer. We started in Ukraine because its market we understand well and it's not full of competitors, as psychologists don't usually use specialized software. Also, they suffer from high workload, so we can help Ukrainian psychologists free up time for recreation and the new clients. In the United States, the market is competitive, especially as psychologists must maintain appropriate record of their work by their domain ethic codes, and the psychologists get used to work with insurance. So we see potential by streamlining these processes and this daily routine. While AI speech-to-text writers is not a new technology, our solution will be uniquely designed for psychologists, ensure a secure environment according to specific needs of mental health professionals. During the program, we reassembled the team, conducted comprehensive research focused on customer problem fit, technology aspects, personal data, and legal consideration for launch. And now we started developing an MVP based on open models and communicating with early adopters in Ukraine. to validate solution and gather feedback. And our next steps include forming client agreement, intensify our search for early adopters, and aiming for launch MVP by August 1st. I'm Victoria, represent a team of 2 co-founders with experience in marketing and software development, and also we have a psychology advisor who had startup background. And now I will hand over to Mikita for the demo presentation.
Okay, so on the main screen, you can see a list of your clients, and let's open your recent session with Andriy. Here is basically summary of your session, some key topics and exercises that you've done with him, so you can go through it and prepare for your next appointment. Below the history of your client attendance, so you can come back anytime and go through any session you want. Now let's record the new one. And when the session is done, you have the summary immediately and the opportunity to add some notes by yourself. Also, a system can automatically define tasks that you need to do, like send home practice files and etc. Then click Save, and another crucial thing is preparing for supervision. You can automatically generate the supervision template with certain case in your practice, so there is no need to read your paper notes for hours anymore.
Yeah, thanks. So please remember our team at the early stage from Ukraine, developing a tool for psychologists, and we're seeking early adopters and psychologists who would be interested in using our product.
Thank you. Thank you very much, Victoria. Anna, perfect timing, exactly 4 minutes. And now we are moving to a Q&A session. I will ask you to stop sharing the screen so we can see our expert panel. And experts, please, your questions. Okay.
Hey, Elena, if you can hear me, Elena.
I can hear you, Aaron, and we can hear you.
Excellent. Thank you very much. So I would be very brief. The presentation was very clear. One of the questions I have is on the confidentiality of doctor-to-patient conversation when we have this technology. How do you address the concerns both from the patient as well as from the provider? Thank you.
Mm-hmm. Yeah, the question about concerns from the patient and providers resolves at the situation when patient is also interested in the correctness of the information, because the treatment will be based on this information and not only doctor's memory, but also this notes. So I think the interest should be both on the side of the client and doctor. And doctors don't usually have concerns because they work with client information and also they store their information. Someone we told to even do audio recording. So doctors get used to work with information.
Thank you. Any other questions? If no, we have a question from the audience. Or
I can jump in on Elena as well.
Yes, sure.
Great. No, thanks very much, Victoria. It was a great presentation and very clear. I'm curious as well about if you put any thought into how you would help those who uptake your service and the technology, how they could be in terms of explaining the value of this as well to those who are in these sessions, just so they're aware of it and understand the benefits, and also obviously opportunity to opt out of it as well. Has the team put any thought into that in terms of how you would integrate this service into the practice, given that it is another, so they actually are aware of it in terms of the that they are being recorded, but it's being doing for certain purposes?
Mm-hmm. I'm not sure that I get the question right, but if I need to explain how to bring the benefits of the solution to doctors, I can explain, and both for clients of doctors. What should I explain?
It's also like, how is the service, have you put thought into how the service is integrated into the actual workflow of the doctor?
Yeah, okay, I got it. Like doctor buys a subscription and downloads the app and then asks the client to use this app. Client can also get summaries from the application if doctor allows to. So yeah, and psychologists start to use it during the sessions.
Fantastic, thank you.
Thank you very much for the answers and questions. Our Q&A session is over for Say Soft, but there is, Victoria, Anna, a question for you in the chat. Yeah, you're welcome to answer that. And we are moving to our next team to pitch, which is Remind, and to get ready is Team Active Generation. Team Remind is represented by Sophia, and this team have developed a disposable bracelet that ensures timely medication intake for the elderly, combining convenience and care in one device. Sophia, please let me know once you're ready, because I'm ready to time you.
Do you see my screen?
Yes.
Okay, fine, I'm ready.
Great.
Okay, good afternoon, everyone. My name is Sophia, and today I want to present you the result of our work on Remind bracelets. Today, a lot of elderly people forget to take pills in time, which can cause some problem with their health. We start from the idea of silicone bracelet with medicine on it, but we find it so expensive to one use. So our final idea is waterproof paper bracelet with medicine on it. The medicine will be put all around the bracelet in the hermetic container, so it will not be affected by the environment. To get the pill, you have to press from one side of the bracelet and get the desired pill from the other. We will develop a different set of medicine for chronic disease with pharmaceutic. In one bracelet, there will be enough pills for person for 1 day, and after that, person need to switch it to other bracelet. Firstly, our bracelet will use people with chronic disease or elderly people who forget to take pills in times, but it can also be used with sportsmen or all people who need to take in vitamins. We didn't find the exact product as us. The closest thing is just using reminding programs and container for pills. But we find our idea better compared to others because it's comfortable and easy to use. Also, when you buy it, you don't have to worry that you will forget your pills because it will always be on your arm. And as I said, it will be on your arm. It will take less place than a container for pills. We plan that our bracelet will cost $1. This price can include all cost of materials and basic cost of medicine, but the price of this bracelet will change due to different medicines that will be put on here. As we said before, one bracelet will be for 1 day, so it will be better to buy a package of such bracelet for 1 month. Such package will cost $30, and you will forget of buying medicine for a month. During this program, we changed the idea of bracelets and started on working on it. Our actual status is working on MVP, after which we want to interview people and to get a review, is this bracelet important or not, after which we want to start selling and working on other sets of for chronic disease. Our team consists of 3 girls. 2 of us is marketer and 1 is technical designer. And we're looking for pharmaceutic or doctor who will help us to make set of pills. If you're interested in our idea, you can contact us. Thank you for your attention. Let's go to demo.
We offer a waterproof paper wristband. Medicines will be placed throughout the entire area of the bracelet in sealed packages and will not be affected by the environment. To get the pill, you need to press on one side of the bracelet and get it from the other. Together with pharmacists and doctors, a set of medicines that a person with a certain chronic disease needs will be developed. The amount of medicine that a person needs to consume per day will be placed on the bracelet. After using all the medicines, the person throws away the previous bracelet and takes a new one. We want to sell 30 bracelets in a package. That is, Buying such a package, you will have enough medicines for a month.
Thank you for your attention.
Thank you very much, Sophia, for your pitch and for your demo. We are moving to the Q&A session, and I see already first question from Erki.
Yeah, thank you very much for this presentation. I wonder how much of the market research have you done? I personally have seen during the last 3 or 4 years at least 5 of similar type of solutions, maybe different form, maybe different approach, but kind of the function of the solution is more or less the same. So what is your differentiation strategy? Thanks.
Thank you for your question. Maybe we didn't search the market enough great, but in Ukraine we didn't see such product for any people, so it will be useful for them, we think. As I said, it will not be so expensive because it is just a paper, which can also be used like to go for different parties or aqua parks. So it's just putting a container of pills on the bracelet and walking with it, but it will not be so expensive. So I think it will be useful.
Yeah, reach out to me. I can send you the links to your competitors.
Okay, thank you.
Thank you, Erki and Sophia. Any other questions coming from the expert panel? Dean, Aaron, Natalia? Okay. If we don't have any more questions, then I would conclude the session of Q&A for Remind. Thank you very much, Sophia. And we will be moving on to our next team, which was supposed to be Team Active Generation, but probably for some technical reasons, they are not able to join us right now, unless they've joined in the last couple of seconds. So Active Generation, are you with us? Seems like no. So we are going to move to our next team, which is team number 6, Ukraine Global Scholars, represented by Sophia. And the next team to get ready is Right Decision. On the team of Sophia, Ukraine Global Scholars, they created an engaging app that supports children with type 1 diabetes and helps their parents understand and manage the condition together. Sophia, we can see your screen.
So can we see it now?
Yes.
Good afternoon to everybody. Mm-hmm.
Yes, we can see your screen. And let me know when you are ready to start pitching, because I'm ready to start timing you.
Okay, I think that I'm ready right now.
Great, let's start.
Okay, so 17 years ago, when I was born, diabetes wasn't even on the list of kid disease. Yet, it's been almost a decade since this chronic condition started to spread rapidly among this age group. You will be surprised, but 50% of all diagnosed are reducing taking medicines because of the biases around this topic and the bullying they're encountering from their peers. The probability that these kids will die till my marriage is 60%. To help diabetic kids cope with peer pressure and bullying, we created Lumi, a mobile application that provides short educational animations, simulations of challenging scenarios, peer support, and muscle relaxation techniques. Using it daily, kids will obtain credible knowledge about their disease and increase their sense of control over it. So, what is Lumi capable of? First of all, it's about debunking misconceptions. Then it's explaining the nature of diabetes to students' peers and training on managing the disease in public environments. Our business model is business to mass, so our customers are parents and clinics, while our target users are kids. So we strive to combine our competitors' advantages and add more interactive learning, personalization, and user-friendly interface. These trends will ensure that these kids stay on track longer and are engaged in their learning process. Additionally, our solution will be free of charge, multilingual, and accessible worldwide. To make money, we will apply for the grant programs. Addressing this problem now, we can improve kids' social lives and provide a toolkit for effective self-management in stressful situations. It will also empower
Sophia, are you with us? Maybe
an advanced pilot version of the application.
So, Sophia, just for you to know, we lost you for some time.
Is it okay right now?
Yes.
Okay, yeah. So the application right now is in the prototype stage, and we are developing our MVP to access the market. To help us accelerate the process, you can join us as a full stack developer, IT specialist, or help us raise $2,000 to enter the market. Lastly, I want you to have a look at our demo to see how the application works. Okay, and I think it might be some connection issues. Just a moment.
Yes, please try to reshare your screen.
Yeah, just a second.
With the new Lumi mobile app, your diabetes-affected child can enter the gamified educational world of type 1 diabetes. Registering with their name and age provides a personalized experience for the youth. Using this feature, they can create their mascot just like them, with a patch or a pump. In settings, kids can personalize their game experience to whatever they like. It's also possible for a parent to connect to their child's account, track their progress, and possibly edit their child's experience. In this educational game, for example, players aim to reach an average glucose level by choosing products that make it high or low. By selecting the right option, they will succeed and gain coins. With coins, they can buy new features for their mascot and access new levels and attributes. Download the Lumi mobile app in the App Store or Google Play to get started and see how to make your kid aware that diabetes is not their whole personality, but their spark.
So finally, our solution is not just about addressing a health condition. It's about fostering behavioral changes, healthy habits, and the empowerment of kids experiencing diabetes. So thank you, and right now I'm ready to answer all questions that you might have.
Thank you very much, Sophia, for your presentation and demo. And we have a first question coming from Natalia, or maybe a first two questions.
Hello, thank you for your time. Thank you for your presentation. I would like to ask, do you plan to develop for adults, part for adults persons who first time in their life was diagnosed, for example, not diabetes first type, but also diabetes second type? And how many clients in your pipeline for current time?
Okay, sure. So yeah, thank you a lot for your question. Actually, we were thinking about only creating app for kids and adolescents. So basically our like customers and target audience age group is starting from 6 to 12 years old. So it's not even like the teens or more adolescents, but kids. The reason behind it is we feel that for adult people, there are already a lot of solutions that they can use to manage their disease. Meanwhile, for kids, there are a few and some, but they're not as powerful as could be, and we hope to advance them and add additional features. So the answer is we plan to do this only for kids.
And what about quantity of clients in your pipeline for a current time?
Could you repeat the question, please, and maybe make it more clear because I can't get it.
Have you any clients in your pipeline?
Do you mean like people who already using the application, we can get their feedback?
Yes,
So not yet, because we are still on the MVP stage, so we haven't launched it on the market. And right now we are just trying to basically develop the MVP and hope to also gain some finances to launch this market, because it still costs some money. So not yet.
Okay, thank you. Thank you for your answers.
Thank you a lot.
Thank you. Any other questions from the expert panel?
Yes, I have a question, Elena. Quickly
yes,
yes, like on engaging patients, we are talking about children with diabetes. Was there any attempt to involve them in designing this application, whether there's a need for such solutions, or it's just derived from you as developers?
Okay, sure. Thank you a lot for your question. I have to say that the idea of creating such an application appeared because all of our team's friends or relatives have this condition, and specifically kids. And we chatted with them and talked with them and understood that there's a really need and demand in such solutions, because all the applications that are existing right now, they're not really engaging and they don't have such interactive content, etc. So kids are not using them. And comparing to other competitors like peer support group that are held in offline, kids are not really open at this age to attend them. And so basically the answer is there's a high demand right now of such solutions, and there are not a lot of them. And about actually attracting kids about using it, first of all, there's the demand already, so they will be interested. And secondly, we hope also to engage in this process clinicians, so pediatric doctors and parents of kids who will maybe show the kids that this solution is currently on the market, and to kind of direct kids to go and search for such an application. And secondly, it's of course our job to make it as engaging for kids to stay longer and to use it more than a few days.
Thank you very much, Sophia, and thank you, our experts, for the Q&A. Unfortunately, we are out of time, and we will be moving on to our next team. And our next team to present is going to be Right Decision with DocDirect to get ready. Right Decision will be represented by Serhiy, and they, with the team, created an AI-powered Wi-Fi module with a voice recorder in a waterproof case that can be embedded in plush toys. The module is designed to provide children with stress relief and emotional support. Welcome to the stage, Serhiy. Let me know when you're ready to start, and I'll be ready to start timing you.
Yeah, thanks for this great introduction. You can start the timer. So we are Right Decision. We introduced Ollie, an AI-powered module for toys. So the problem that we are trying to, so starting with the team, we are consist of two regular members, being Elena Kritska and me. We're both lawyers gathered around the social protection, and I'm a humanitarian myself working with beneficiaries. And what problem we're gathered around here today is the issue of increased stress and anxiety among kids all over the world, especially in areas of hostilities, especially in Ukraine. And part of that, parents often struggle with ensuring their kids' safety and well-being when they are not at home. And for this, we introduced Ollie module. What Ollie can do, it talks to kids in a friendly manner, soothing them. It guides parents and kids through stress relief exercises. It also plays songs and some regular music that kids can listen to, and it creates custom stories based on the child's communication. It comes supported with an app for parents, which can track the location of the toys all the time. It provides noise alerts if the volume of noise around the kid is too loud, and it creates daily mood reports based on the child's communication. With toy manufacturers, they come with benefits, as if the toy manufacturer partners with us, so they can stand out being with a unique product, including the mental component. And as the toy market is very, very large, there definitely must be a place for social support there. Our product will cost from around $15 to $40, depending on the manufacturer, and all of the analogs cost $60 or more at the moment. Our state of development now is we have product design finalized. We have created a baseline model. We compiled all of the psychological data we need, and we also have designated schools that we can partner with. Our go-to-market strategy is B2B. We'll be licensing our software to the marketers, and they will use it when manufacturing the toy, and we will also will be selling the modules themselves. We'll provide the free toys to vulnerable kids all around the world, prioritizing Ukraine with every purchase of the toys. We have a proven concept, Ibuki, which uses toys as psychological and stress relief treatment for inclusive kids, which proven its success, and it's used all wide in Ukraine, and we will use it to pilot our project. We'll have the worldwide impact for children aged from 5 to 9, and we'll be scaling a lot because those models can be translated to every language and then can be embedded in every toy, and keeping our social approach with buy one, give one. And now knowing all that, let's make the right decision for our children's future together. We do not have a demo for this part, and we can move to the questions from the audience and experts.
Wow, like exactly 3-minute pitch. Thank you very much, Sergey. You can stop sharing the screen for now, so maybe we can see our expert panel. And I am inviting here our experts to ask questions. Yes, Erkki, please.
Yeah, thank you very much. My comment is actually general for the majority of the presenters, not only this one. You are mainly describing to us the functions of the product, and this is okay to do that. But I would like to hear more your discussion around the clinical benefit. And how are you going to prove that it really works what you think that it does? The majority of the pitches have been just concentrating on the product features. But in order for the medical community to really start prescribing it or accepting that, you have to show, as any device or as any pharmaceutical intervention, you have to show that it really works. Thank you.
Yeah,
and once again, this was not related to this specific product, this presentation, but in general.
Yeah, sure, but I'll just comment anyways. We have this Ibuki concept that we've shown, and they have all of the trial records for this. They use toys basically without our product, the same toys when treating kids with stress, with depression, mostly inclusive kids. And it shows that 95% of the kids who undergone this treatment from 2006, they've had decreased level of stress, decreased level of anxiety, and increase in personal well-being. So that's the idea that we were basing all about. Yeah, Dean?
Thank you, Dean.
Right. No, thank you very much for the presentation, and yeah, very interesting approach. I'm wondering if you had any discussions with parents and just, I know, some of the ethical kind of considerations with your product, with recording kids and these things. I think, yeah, any device that records, you know, somebody or even a kid without potentially them knowing, you know, has issues. But obviously, yeah, I was wondering if you've thought about that and how that sort of sits. So.
Yeah, we thought about it a lot, and we had a lot of conversations with parents, with psychologists, and we've outlined those risks. And obviously, parents are concerned with the data security because the kid will be talking to the toy all the time, and it will track its location. So what we will need to do is hire data protection specialists, create a senior department of data protection specialists who will, the only thing they will do is monitor how we are treating our data and who has access to this data, because we understand that one employee with some malicious intent can destroy a lot just by typing a message that will be set by all of the toys all over the world. So yes, this issue is very, very critical, and we put strong effort to decrease the risks of it. Yeah, thanks.
Thanks very much. Appreciate that.
Thank you very much, Sergey and our experts. for this pitch and Q&A. And we are down to 2 more teams to pitch and answer your questions. The next one is Doc Direct, and after that we'll listen to Свої рідні. Doc Direct is represented by Volodymyr, and the team of Doc Direct developed a mobile app that enhances communication and support among psychotherapists. Welcome, Volodymyr. Volodymyr, we can see your presentation, and I'm also ready to start timing you. Are you ready to present?
Yeah, I'm ready. We can start.
Great. You can start.
Okay, hello, my name is Volodymyr, and let's talk about Doc Direct. Due to the ongoing situation in Ukraine, the demand for qualified psychologists has become more pressing than ever. Today in Ukraine, psychologists are struggling to find mentors, also known as supervisors, in order to enhance their skills or even get mental help for themselves. Through our conducted surveys, we discovered that almost every 5th psychologist face difficulties with finding a supervisor, as well as validating one's experience. Furthermore, almost half of them complain about high cost of supervisions. Our aim is to empower psychotherapists with a tool to widen their knowledge. On the other hand, we want to provide supervisors with a platform to share their knowledge and guidance. In order to achieve that, we've developed a user-friendly platform for efficient communication between psychologists, as well as a tool for seeking and connecting with supervisors. And let me show a quick demo here. So here is a desktop version of our web application. It has a user-friendly and simple design with all the required features. Here, a user can go to the list of supervisors and pick the right one based on the rating or our cost rates. After opening a detailed description, he can see certificates of qualifications and also feedback from other clients. If it is the right match, he can open a user-friendly calendar and make an appointment for supervision. If a supervisor approves it, that's it. Supervision has been scheduled. Now let's get to the market. And the global psychology and counseling market is valued at $27 billion. Within this, Ukrainian supervision's psychological market is at $10 million. Our aim is to capture $1 million share in the first year after launching our product. We truly believe we can reach those numbers because there is no good solution currently available. The only competitors are websites of small psychological associations or local chat groups. We overcome them by offering a verification of supervisors' expertise and a rating system that will make it much easier to pick the right supervisor. Our product committed to offer lower prices thanks to competition between supervisors within our platform. Doc Direct is a united community where everyone can share their knowledge and expertise. Today, we present statistically proved idea with surveys and deep interviews. We are in the stage of developing MVP and plan to finish it by the end of this month. We are going to start at Ukrainian domestic market with plans to expand internationally as soon as possible. Our ultimate goal is to solve the supervision needs for various med experts, not only psychotherapists. Our team consists of highly experienced tech guys and our med expert Christina. By the way, she came up with our product idea herself because she faced that problem numerous amount of time, as well as her colleagues. Today, we are actively looking for investment for future developing, launching marketing campaigns, and scaling to international market. Our next hire will be marketing and sales experts, so we are open to collaborating. Reach out us through the provided contacts, and let's improve mental health industry together with Doc Direct.
Thank you, Volodymyr, for the pitch. And we are moving on to our Q&A. Any questions from the expert panel?
Yes, I have a question, Elena.
Yes, Aaron, please.
Yes. Thank you for the presentation. Very interesting. My question is, how would you plan to attract very kind of senior and certified psychologists to be supervisors and enroll in your system? So, like, what is the benefit of course, could be financial, but how will you make sure to invite the good candidates into your pool? Thank you.
So first of all, we are going to contact the psychological associations. So like in Ukraine, the most famous is Ukraine Psychological Association. We're going to take supervisors from there, and it will be a trusted source of experts. And what is their motivation is that because on our platform, we will have rating system. So of course, the number of completed supervisions, etc., certificates is for some number of conducted supervisions. So it will be working on their reputation.
Thank you. Erki, your question?
Yeah, I actually had a very similar question. So what is the motivation of the supervisor to go there? And just additional comment, you have to develop a supply and demand at the same time. You know, the supply of the supervisors and the demand of the supervisors. And if there is a mismatch in the supply and demand, you will run into trouble. So yeah, I don't know if you have thought about that.
Yeah, thank you for the question. So yes, the first one question is, as I said, it's just because of our platform will be provide some reputational benefits like rating for the supervisor, number of conducted supervision, etc. So the better supervisor you are, the better rating you will have, and it will be working there. And if you are talking about supply and demand, our plan is to firstly encourage supervisors on our platform, and only after that encourage supervisee on the platform. So when they will come to our product, there already will be supervisors to conduct sessions. So that's basically our plan, and we will start at that.
Thank you. I think we have time for one quick question and answer, if there are any, or there is any. Okay. In this case, thank you very much, Volodymyr, for your pitch and for your answers. And we are moving on to our last but not the least team Свої Рідні, and the presenter is going to be Igor. Свої Рідні team is on the journey to empower patients with chronic diseases through its innovative self-study platform, offering vital knowledge for patients and their families. And we are able to see the pitch deck of Свої Рідні. Igor, let me know whether you are ready to start pitching.
Yes, I am, if you can hear me.
Yes, we can hear you. And please start.
So, hi, my name is Igor, I'm a GP, and this is our educational platform for patients and their families, Твої. 7 out of top 10 causes of disabilities in Ukraine are non-communicable diseases, according to WHO data. That's about 22 million people in Ukraine and about 2 billion people in the world, and this count is rising. The problem is when the patient with a chronic disease comes to a GP has only 15 minutes to tell everything which is going to happen with the patient through all of his life. And the actual time needed is 4 to 6 hours. This is how the time gap is formed. This time gap leads to lack of understanding, lack of knowledge, and increase of disability. So we've come up with the solution Tvої. It's first in Ukraine educational platform for patients and their families. We've started off as an idea on Health Hackathon. This was step 0. Now we are approaching to step 1. It will be donor funded. We will create 5 gamified online courses free of charge for everyone forever. And we are fundraising right now. Next steps will provide sustainability. They will be commercial. We will create additional commercial courses, premium subscription for clinics, tailor-made courses for the needs of clinics. And our big goal is to create a market of patient education in Ukraine. Our competitors are of 2 main types. First one is educational resources for patients. Their disadvantages are one resource is created for one condition. And second type is non-specialized educational resources like Coursera. Their disadvantages are no specialized education is available for patients. We want to cover these 2 disadvantages. Many health conditions will be available in one place at Tvої. What is our customer model? Please turn on your imagination. So meet Maria. Maria is 55 years old. She has some chronic condition, for instance, diabetes. She comes to her GP, Anastasia. Anastasia uses her 15 minutes to tell Maria everything she needs to change in her lifestyle according to her disease. And afterwards, she sends Maria a link to our free of charge course. And this is Anna, she's 31, the daughter of Maria. She went through one of our commercial courses, and there she saw a lot of disclaimers. If you have a relative with a diabetes, please help her go through the course. And Anna sent Maria a link also. This is how we double the chance Maria going through this free of charge course. And this is our team. We are all GPs, first of all, and we have experts like text and communication experts, nutrition and CD experts, bloggers, educational experts, and we can provide this platform. So right now we are fundraising. So if you have any ideas how to help us, please write me an email and you can join our super great project, as I think. So this is our platform I would like to show you. Here are all of the courses. Let's go through the courses, the free courses. The free courses, as you can see, there are 5 courses like diabetes, asthma, cardiovascular disease, suicide, and mental health conditions. Let's go through diabetes. Each course will be provided in 3 main types: full, simple, and the simplest is for different skilled users. The full version are like a TV series. It will have 8 classes with scripts and so on. They will be interactive and the patient can go through these TV series. Simple course will be formed in the form of text version or audio version, so you can listen or read. And the simplest course will be provided in the form of a newspaper. So the patient can print the newspaper and go through the course. So we are called Svoyeridny. Thank you for being with us and please support TWI. Thank you.
Thank you very much, Ihor, also for exactly great timing with 4 minutes. And we are starting our Q&A, and I already saw a question from Natalia.
Hello, thank you for your time. Thank you for your presentation. Have you any courses for a current time? And who is owner of the content for these courses?
We don't have any courses. We are right now approaching to MVP creation. We are planning courses, so we have some draft scripts, and the owners, we are the owners. So you saw our team, so we are the owners. Yeah.
Thank you.
Thank you so much.
Thank you, Erki.
Yeah, thank you very much. The problem, of course, is huge, and the problem is very similar regardless whether this is a rich country or poor country. Maybe the reasons are different, but I think that every country, every health system in the world is struggling with the same thing. My question to you is a little bit philosophical. How do you deal or how do you find the balance between the general suggestions like be healthy, sleep, don't drink, avoid stress, with a very specific condition related or certain specific circumstances related suggestions? Because this is what the most of the startups in this field struggle. Where is the balance between very personalized program and general, to some extent, very simplified suggestions?
Thank you. It's a perfect question. So me as a GP, first of all, during my career, I've understood that patients, they don't follow general suggestions. So there are no such words as be healthy or eat healthy, right? Because me as a patient, I don't understand what that means. So we are going to provide very specific suggestions, like Harvard food plate. You're familiar probably with that one, or physical activity, which is recommended by WHO. Only specific suggestions are understandable to patients, and only such kind of suggestions they are going to follow. Even during my work, I even print suggestions with certain rules and steps. So in these courses, we are going to provide very specific suggestions. I know that we cannot include all of the states which are going to happen with each patient, but in 80, probably even 90%, general states are the same among, for instance, among people with diabetes. So we are going to be very specific, as we are all GPs and we have vast experience in that.
Thank you very much, Igor. And we are also out of time. Thank you for your pitch and for the Q&A. With this, we are done with all of our teams pitching and answering the questions. And before we are going to move to the section of the day where we are going to give out some prizes, I would like to ask our experts in the panel to maybe, after listening all of the pitches and all of the answers, to give one advice to all of the teams, knowing that this was just the pre-acceleration program, the start of the journey, and most of the teams have quite a lot to do in order to finalize the product, in order to bring it to the market. So one key advice that you would formulate. Yes, Natalia.
Dear teams, thank you for your time. Thank you for your presentation. I think that I would like to recommend you focus on your ideal customer, because of course your ideas are brilliant, but definitely you have to understand who is your main and ideal customer, and you have to polish your product from this point of sight. Thank you.
Thank you, Natalia. Erkki?
My general suggestion is, as I already said, concentrate to the clinical benefit, or at least you should have some kind of hypothesis or idea. How are you going to measure if the product really works? This is the first thing. Second thing that comes out of that is that at least in Europe and USA, this answer to this question feeds into the regulatory strategy. What kind of claims, what kind of classification, and this in turn feeds into the commercial strategy. So start by really identifying the clinical need and identifying your way how you start to measure the change, or the measure the impact you're going to make.
Thank you very much, Erkki. Dean, Aaron?
I can jump in and so, okay, Aaron, you go. Sure.
Sorry, I'm struggling to raise my hand, so that's why I'm interrupting. Sorry, Dean. So I think it's more repetition already. Erkki has mentioned. I think the importance of having a proper research kind of supported projects. I'm seeing a lot of anecdotal evidence to initiate this design of the project is being used, like from word of mouth. I think what I would encourage is more, whether it's literature review or secondary data analysis of what is actually needed from providers, from patients, from overall health system in Ukraine will be quite useful. And obviously, I think engaging in some sort of, at some stage, the patients themselves or the end users is going to be key for all the projects that we have listened so far. Thank you.
Thank you, Aaron. And Dean?
Yeah, thanks very much. No, really a lot of fantastic ideas there, and they're off to a great start as well. And a few that I've seen at the hackathon have already, they've already come a long way as well since I've last seen some of these original ideas and concepts. I think it's just to echo a lot of the fellow panelists in terms of it's definitely having a firm idea of the problem that you're trying to address. I think especially for our, I was very encouraged to see the learning platforms in different formats by a few of the teams, but it's how they distinguish themselves from a lot of the free content as well that's out there, but also content that potentially is, maybe not as controlled or regulated as well. So how do they make sure that their product is meeting those, finding that space as well? So I think there's a lot of really fantastic ideas that are out there, but I think how to also distinguish itself from like the YouTube channels and the the other sort of aspects that are out there that are doing education, fulfilling education purposes, but also maybe to different levels of standards as well. So yeah, very happy to see the progress so far.
Thank you very much, our expert panel, for all of your advice. And I hope that all of our teams took a note about what you mentioned, and immediately after this event, they'll start working in order to make all those amazing ideas reality and successful in future. And we hope to hear about all of those ideas in a year, 2, 5, in Ukraine and also outside of Ukraine. Once again, thank you very much, all of our experts, for taking time today and listening to the speeches carefully, asking questions and being very proactive. And I will be moving on to our next part of the evening, and we'll try to conclude our event today as fast as we can. And this section is about actually trying to motivate and provide some further opportunities for our teams to grow and develop. And we have three prizes prepared for the teams. I will be starting from the first one. We are excited to provide for 3 of the teams in our pre-acceleration program tickets for the IT Arena 2024. These teams have shown a lot of proactivity and engagement in our workshops. They were actually trying to seize every opportunity available, and we want to provide another great opportunity to participate in one of the largest tech conferences and events in Ukraine, which brings more than 5,000 entrepreneurs, innovators, and ecosystem players in Ukraine for discussions, networking, and different opportunities. And we hope and believe that for these 3 teams, IT Arena can become a great platform and another opportunity to accelerate solution and develop. And on behalf of the team, organizers team of our program, we would like to award this prize to, first of all, Right Decision team, second of all, to Dog Direct team, and third of all, to SaySoft. Dear Right Decision, Dog Direct, and SaySoft, we will be happy to meet you on this event. Our almost whole team is going to be present at IT Arena as well. And we can congratulate you on this prize. Another prize that we have prepared is mentorship from WHO Ukraine. We are delighted to provide this opportunity for the 2 teams from whom WHO Ukraine decided to support further and help out with the development of the solution. With this mentorship, these 2 teams get an opportunity to further get in touch with experts from WHO and work further on the solutions. And this will provide an opportunity to further grow and develop those 2 teams and solutions. And we want to congratulate Team Ukraine Global Scholars and Team Свої Рідні with this prize. And we hope that this will be fruitful and helpful for your future development. Yay! Congratulations to you. And our third award is probably quite easy to guess who it will go to. During our program, we've been asking constantly the teams on what are their needs, what is there that they lack in order to develop further. And one team mentioned that they need more of the glasses in order to test their solution and validate their product. And right now they only have 2 prototypes. So we together with WHO, with Civita, Radartech, and all organizers of hackathon and pre-acceleration program would like to help Extravision and give out to them as a gift HoloLens 2. So congratulations, Extravision. On this, we hope that this will help you to accelerate and get to more clients and customers faster. At this moment,
thank you so much. Thank you so much.
Sure.
I really appreciate your help.
At this moment, I would like to ask exactly whether any one of our teams would like to say some words. Mark already said a couple of first words, but maybe any other would like to mention something. Yes, Ihor.
Yeah, do you hear me? Yeah, I suppose you do.
Yes.
So thanks so much. I would like to thank to all of Radartech and Civita team and WHO team for this amazing process. A lot of so we've started, as I told at my presentation, we've started off just as an idea, and actually you are a big pusher. You know, you gave us a huge push. So we are at right now we are at another level. And I thank you so much for clarifying different things, because we are all GPs, and clarifying different business and IT things are very important to us. So thank you to all of your teams. And it was very important to us. And I believe that it's not the last time we see each other. And that's true. Thank you so much.
Thank you, Ihor, for such nice words. It was a pleasure working with all the teams. Yes, I see also Volodymyr's hand.
Yeah, I also want to say thank you very much for those beautiful prizes, and most importantly for the program itself, because yeah, it was really insightful. Lectures were meaningful, and especially one-on-ones with experts, the amount of money you spent for them. So yeah, just thank you.
Thank you, Volodymyr. Thank you very much for these nice words. And I see also the hand from Vladislav.
Yeah, thank you so much. We, from our team, are very grateful that we take part in this program. We very want to say thank you to Maria Romanova, to Yuri Volodymyr, to Natalia, to Anastasia for their exciting organization and for their help in every stage. And also we want to say thank you to mentors, to Volodymyr Nerubenko, to Ivana Sachi for their help and their comments and supporting us. And for thank you for this great gift. I will try to use it and to take as much help from it as possible. Thank you so much.
Thank you, Vladislav. Thank you. Okay, I have another hand from Gleb. Okay, let's
yeah.
Another.
I want to join to this thankful and really a lot of really thanks for organizers for For colleagues, for Lena, for Maria Romanova, it's really important to us. This accelerator keep us on a track, and this is the best prize for us. So we looking forward, and we make big results as well. Thank you.
Thank you, Gleb. We really hope for all of you to succeed and to see your great results real soon. Since we've already started the gratitude last and hopefully very pleasant part of saying and giving our gratitude, I would like to express gratitude to first of all of the teams first of all, to everyone who contributed and participated in making this program happen and possible. First of all, these are teams that spent time to participate in workshops, to go to mentorship, those teams who first of all came to hackathon and spent 48 hours there to create solutions. Thank you very much for your participation, for your desire to contribute to health tech development in Ukraine, to solve really urgent problems we have right now, and for your enthusiasm despite all the hardships and challenges that we are now going through in the country. So thank you very much. And I know that in Zoom there is this opportunity to clap, put hearts. So I would like to clap to everyone who from the teams who participated in this pre-acceleration program. I would also like to express gratitude to all of the workshop speakers. We had quite many from different countries who provided different insights, and everyone was really excited to help us in this pre-acceleration program and provide insights and their knowledge and expertise that they've earned throughout many years. So thank you very much. Also, huge thank you and gratitude to our lead mentors. So 6 experts, Alexander, Volodymyr, Kyrylo, Yevgen, Ivan, Dmytro, who put a lot of hours to talk, to help and support our teams, and who really took it very personal. We know it from our conversations with them in order to support teams in their success and in their development. Thank you very much. This would also not be possible without the organization team. Maria, Yura, Natalia, Nastya, who put a lot of hours into working on this program and making it happen for all of the teams, whether it's workshops, mentorship, demo day, or any other requests that we had. So thank you everyone who did make it happen. Of course, we would like to say huge thank you to our program partners, World Health Organization and Canada government, who supported us financially and who helped us financially and with their expertise and with a lot of insights and who made this also happen. Without World Health Organization, we wouldn't have nor a health hackathon nor this health pre-acceleration program. And we hope that we will be having more opportunities in future to work and create value and impact together like these 2 programs. And on this, I would like to conclude our event and the pre-acceleration program. We'll be in touch with every team afterwards. We are not saying goodbye forever. We will be happy to follow you in a nice way, to keep being in touch. And for everyone else who joined us today and listened to the team speeching, to our panel's discussion, please let's stay in touch. These are QR codes to our pages. We are having a lot of opportunities for early stage startups, teams, hopefully also in health tech industry. So we'll be posting news and stay tuned about everything that is going to be prepared from our side. On this, and that's, I guess, the last slide I have. So on this, I would like to conclude, say thank you to everyone who participated today and spent this 2.5 hours with us, and have a great evening, and hopefully we'll see you soon at some other events or programs.